Welcome to Way to Paces, one of the free sessions. Today is station 2, history taking for MRCP paces. The scenario is you're a doctor in Dermatology Clinic. GP referred 30-year-old Santhosh Giri. Thanks for seeing this young man who has noticed the white patches of the skin on both hands. He's very anxious as he's getting married in 4 weeks. What is the likely diagnosis and the course of management? And Dr. Sriraj will be the candidate. For the time scale, for everyone's sake, I'm telling, we'll start the consultation. At 12th minute, I'll give a warning, and then 2 minutes more to wind up or concerns or anything, and then stop 14 minutes, 1 minute to collect your thoughts, and then 5 minutes with the examiner. Then the feedback. This is the structure. Is that okay, Dr. Sriraj?
Okay, yeah.
Yeah, start.
Hello. Hi, I'm Dr. Shiraz, one of the doctors here.
Yeah,
Can I please confirm you are Mr. Santhosh Giri, 30 years old?
yeah.
Hello, Mr. Santhosh. Very nice to see you today.
Hello.
So, Mr. Santhosh, I can see from your notes and your GP has referred to me with some problems of white patches on your skin. Can you tell me more about that?
Yeah, it's a very disturbing one actually because I'm having patches on my skin. What do you call outside of this area of the skin. So it's very difficult. So it's getting worse, and I don't know what is going to happen. Whether it spread the whole body, will it come to my face and things. So it's very difficult. I'm struggling actually.
Okay. To get more details from this, can you tell me when did you actually observe this skin patch? What?
This is for nearly just like a started like a small dot, like a 3 months ago,
Uh-huh.
and then it slowly got worse.
Okay. So you said you had 3 months, started since 3 months. Have you had it before or as well? Before 3 months, any time in the previous?
Sorry, what is that? Repeat the question.
Have you had it before than 3 months before? Like you said, it started 3 months ago. And have you had it any time before?
No, no. This is the
No.
first time.
And did it start all of a sudden? Was it gradually increasing now?
Yeah, it's just noticed like a dot, and then I didn't even see actually. Then it's started getting worse and worse slowly.
Okay. All right. Have you noticed anything in particular making it worse, like any exposure to sunlight or your diet or anything like that?
Uh, no, not really. I've not
Okay.
noticed any changes.
Okay. Have you noticed anything making it better? Like, have you applied any creams or anything like that?
Oh, I don't know what creams. I didn't put any creams. I was scared that
Did you
that's make worse.
did you try did you try anything which is making it better?
No, no, I don't know. And that's why
Oh,
I'm here. I went to
okay.
GP, started here, yeah.
Okay. And along with that, have you noticed anything else like problems with your, any skin problem, any other skin problems apart from this white patches?
No, as such, no, I've never been at any problem so far. I'm like
Okay.
fit and
And
maintain problems.
okay. Okay. When you said you had this skin patches, have you noticed patches anywhere else in your body, like in your tummy or back or chest?
No, I don't want that. So that's why I was scared.
Okay. So you think that your white patches are only exposed on your skin, which is exposed to sunlight.
I don't know. It's only on the arm, like my hand.
Do you think it's on the face?
Sorry? No,
Okay. And is it painful?
no,
Have you seen any bleeding from those patches?
no,
Any itchiness?
no,
Any discharge?
no.
What color was it when it was initially started? Was it white or was it red and then changing to white or?
I know it never been red. It's from the beginning. It's a white.
From the beginning, it was a white. Have you noticed, like, have you noticed anything particular making it worse when we exposure to sunlight?
Not that I noticed. No,
Okay. Have you noticed any abnormal sensations in that skin area, like any loss of sensations or anything like that?
I I don't know.
Okay. All right. What diet are you following particularly normally?
Diet.
Diet, yeah. What diet do you take normally?
I don't know. Just normal Indian diet.
Normal Indian diet. Okay. Right. Apart from that, have you noticed any weather preferences?
Uh, no, it's a hot in India, so that's okay.
Okay. All right. Okay. And any weight loss or weight gain?
No,
What about your appetite?
fine.
Do you feel tired?
Uh, just the usual tiredness when you work from Monday to Friday. Before Saturday, you get tiredness. That's all. Not more than that.
Do you think this is something new or has it been the same?
I've been the same. It's all like a. So we all have
Okay.
this from
Have you
school days, isn't it? So that's there, all of that. Yeah, nothing new.
okay. Have you noticed any lumps or bumps in your body?
No,
Any oral sores or private area sores?
no.
Okay. Uh, to ask some more questions, can you tell me any previous medical illnesses I need to be aware of?
Uh, I'm like a diabetic, but it's a little bit tricky one because yeah, I'm a type 1 diabetes.
So, okay, it's a type 1 diabetes. And what have you been taking for this one?
I take insulin, humulin insulin.
Uh-huh. Human insulin. And since how long have you been taking this one?
Like my since I'm 10, 20 years.
Okay. What was your last HbA1c?
I don't know the exact number, but it's everything under control. That part is it's fine.
Okay. Are you in regular assessment for your eye clinics and all?
Yeah.
Okay. Do you get dizzy from standing from sitting position?
No.
Okay. And what about your stools, like any watery stools or loose stools?
No, bowels are
Okay.
fine.
Any flushing, like red hotness on your face?
No.
Any sweatings?
No.
Okay. And have you had any strokes previously?
Stroke?
I mean, any problem with your any weakness in your parts of your body? Had any time any strokes?
No, no, no. I'm just 30. You made
Okay.
me feel as I'm going to be 90 now.
I'm sorry to hear that, but this is one of the complications of the stroke. That is why I wanted to ask you. And do you get any problem while walking? Any pain on walking
No, where? Legs?
in your legs?
No, no, no.
Okay. Any problem with your waterworks? Any frothy urine?
No.
Okay. All right. Uh, have you noticed any dark patches in your mouth?
No.
No. Okay. All right. Any numbness or tingling sensations?
Where?
Anywhere in your like in your hands or legs or around your mouth?
No, no.
Okay. Apart from type 1 diabetes, do you suffer from anything else?
No.
Okay. All right. Oh, apart from these medications, you told me, are you taking any medications?
No, I just take a paracetamol like when I have headaches and things. I just take paracetamol.
And is this bothering? I mean, this headache is anything different, or is this a regular headache you suffer from?
Regular headache.
Okay. Any allergies?
No.
Uh, okay. And what do you do for a living?
IT chap.
Teacher.
IT.
IT. And how is this affecting your life?
Does it need to affect my life? It's okay. IT is normal.
I mean, okay. And do you think this patches is anyways bothering you in your life?
Yes, definitely. Because see, one thing is when people see it's completely odd and abnormal. Second thing is, I'm sure you would have seen the referral. I'm getting married in 4 weeks, so I'm a bit anxious about whether the patch will get spread to my face and things.
Okay. I can see that you are really concerned about you with this one. Hopefully, by the end of the consultation, we'll get an positive outcome and we can discuss about this. What we can do about this. Is that okay?
Yeah.
Any? Do you smoke?
No.
Do you take alcohol?
No.
Any family history of similar conditions, like same patch, same white patches in your family?
No family history of patches.
Any other similar conditions? Any other illnesses running in the family?
Yeah, I have a whole list for diabetes. Both my parents, my siblings, everyone.
Okay. And did you travel anywhere recently?
When you say specifically where?
Anywhere recently, like 3 months ago? Have you traveled anywhere?
No, no, I've just been to India and come back. I've been to India for a holiday and come back here.
Okay. So, Mr. Santos, few quick questions to know what the underlying problem could be. So, have you noticed? Do you think you're paler nowadays?
Sorry, repeat that again. Your voice is muffled.
Have you noticed? Have you noticed? Do you think you're paler nowadays?
Getting paler? No,
No. Okay. And any awareness of your heartbeat or racing of your heartbeat?
no,
Chest pain?
no,
Okay. Any cough?
no,
Any running nose or itchy nose?
no,
Okay. And any tummy pain?
no,
Any high body temperature or any night sweats?
no,
Have you noticed any bleeding from any like in your waterworks or your
no,
any joint pains?
no.
Okay. And okay. And how about your mood?
Mood. I'm very anxious about this patch and things actually. What's going on? Otherwise, I'm fine.
Okay.
2 minutes more.
So, Mr. Santosh, what do you think? What is bother? What do you have any thoughts of what is happening with you?
I don't know. The only thing I can say is it's getting worse, and it might get worse or not. I don't know. I'm really, really scared and anxious.
Okay. So, from what we have gathered today from you, I think that some disturbance. I think what we have gathered today from you is, I think you might be suffering from a condition called vitiligo.
All right. What is that?
The patches on your skin. So that is the reason why you are having those white patches. It is an autoimmune condition associated with other autoimmune conditions, like you have been having type 1 diabetes since long. So it might be associated with one of those conditions. Okay.
What is auto something like that? What is that?
Autoimmune basically means instead of the defense system protecting our body, fire creates problem with our system, is unable to fight properly and can cause multiple problems with our organs, like diabetes or skin problems or problems with our thyroid glands, for example.
Okay.
Okay, so I think it could be associated with one of those conditions. What we need to do is we need to completely examine you first,
Okay.
okay, and do some investigations.
Right. What do you
Okay,
do?
and we'll do some basic investigations to look how your blood control is.
Okay.
Okay, and also we'll do some tests which can determine if it is autoimmune or not.
What is that?
We'll do some investigations called ANA,
ANA. Okay.
and we'll also refer you to the skin doctor.
You are the skin doctor.
Yeah. So sorry.
Time is up. 1 minute to collect your thoughts. Time is up. Exam is time now. Right, what's your diagnosis?
So Mr. Santosh presented with some white patches on both the hands, and his background includes he's a type 1 diabetic and relatively well controlled with no macrovascular or microvascular complications. Uh, my probable differential diagnoses are it could be a part of autoimmune polyglandular syndrome because he has been having type 1 diabetes. However, he doesn't have typical features which entitles to say that it is a part of autoimmune polyglandular syndrome. How it could be a separate entity as well, normal. I mean, without association with any polyglandular syndrome, and I couldn't see any signs of any hypothyroidism or the Addison's disease or anything like that. And it could be my other differential diagnosis of this could be any post-inflammatory conditions of which can cause patches, but he doesn't have any typical history of that.
You said about polyglandular syndrome. Do you want to pin down a diagnosis? You said vitiligo to the patient.
Yeah,
So is it vitiligo?
yeah, it is vitiligo.
Okay. Right. How do you investigate?
Investigation is a clinical diagnosis, and we can do, as I said, it could be a part of polyglandular syndrome, so we can do some other basic investigations like autoimmune profile ANA if it is autoimmune in nature, and
Why ANA?
because as I said, it could be autoimmune in nature,
Okay.
so that could to rule out that one, or it could be just be idiopathic. Uh, and basic investigations look for CBP and ESR CRP to look for any inflammatory markers, renal profile, liver profile to look for how his diabetes control is, and urinary for protein creatinine ratio, 24 urinary protein, and TSH to look for any underlying hypothyroidism, and
How do you manage if it's vitiligo?
so firstly, we should see what are the exacerbating factors in this patient. If he's having any exposure to sunlight, then we will advise him to not to expose to the sunlight and use creams, emollients, and if say the diet is increasing, is some patients might have non-vegetarian increasing the vitiligo. In that case, we will advise him to stop the non-vegetarian, and topical potent steroids can be used sometimes if it is worsening.
Okay. What are the differentials of vitiligo?
Vitiligo, as I said, the one major differential is leprosy, but it has a similar features, but it
Have
has
you,
a
have you said leprosy before?
sorry.
Have you said leprosy before?
Yeah,
Okay.
leprosy, but it has a characteristic sensation loss in that patches which he doesn't have, and other causes could be post-inflammatory or any or idiopathic or uh, uh,
Yeah. Anything else?
I'm not sure of any more.
Why did you ask about lesion in the mouth?
I have asked the lesion in the mouth. He said no dark patches to rule out Addison's disease.
Okay. Right. You did mention about the plan to the patient and he's very anxious, what is your answer about that?
So he said he's anxious because he's getting married in 4 weeks' time. Uh,
Yep.
so probable answer is, he can be referred to cosmetics, and he can be referred to cosmetics, and we can prescribe him topical potent steroids for that.
Yep.
However, I would expect.
Time is up. Right. Over. Off the candidate role and then surrogate role and examiner role, everything is off. Right. How did that go?
Uh, I think it went fairly well, but I think the differential diagnosis for vitiligo was a bit challenging, and I couldn't address his concern that he's getting married soon. I could have addressed, actually. I missed that.
Okay. So I will tell you the feedback. See, I'll start from the beginning. The feedback will be a little bit specific and deep. Is that okay?
Yeah.
Yeah. Okay. See, first of all, the introduction was nice, and then I say it's a little bit tricky. You said very nice to see you, and it's just a way of introduction. But sometimes in history taking it works out. But if you have the same pattern in communication skills and the Breaking Bad news station or a error station, then we might get caught, and they might be a little bit angry with that because they have come with an angry, and he is anxious as well. So I would say yes, nice to see you. It's fine. Hello, how are you? Nice to see you. It's fine. But not like exacerbating things. Very nice. You cut it down slightly. If you have the same introduction for all the stations, I would say assess the situation and then do it. Okay, but nothing wrong in doing that. Okay, quite a few times I mentioned, or the surrogate mentioned that he was scared in the history, and unfortunately, you didn't address that. You say, like, I can understand, or I can imagine how difficult it is for you, and I can see, I hear what you say. So, those kind of things will be helpful. You just went on, I said, I'm very scared, and you went on, okay, is it on the face? Have you noticed anything on the face? So you've done beautifully, but just a little bit of empathy, stop, start will be helpful. Okay? And diet, you asked that, I said normal Indian diet. You could have you could have said a little bit tricky. Rather than asking the diet, you could have asked, have you noticed any food which makes things worse? So that you can say, if it is anything makes things worse. The diet is a like a broad term. If you say diet means, what would you say? You tell me, what would you say? If I ask you what's your diet, what would you say?
Yeah, I agree. I agree.
It's difficult, isn't it?
Any food, yeah.
It's difficult, and that's why I just said normal Indian diet. So it's very hard. So if you want it, the point you are making here is any of the food making things worse. Have you noticed any risk factors? So if you want to check it, ask, and then you can say nothing means nothing. Finish. Most of the time they'll say no, particularly. And then you ask about weather preferences, and I would say elaborate a little bit more, and people might not understand what's weather preferences. And you can ask in terms of do you have any preference to hot weather or cold weather? Always generalize. Some people have preferences in hot and cold. So do you have any particular preferences? Then people will be able to answer. Rather than just snapshot weather preferences, people might struggle. See, we are talking about a person from public. We are not talking about person from. So when you practice with ourselves, with your colleagues, it's fine. They understand all the language. But in general, when it goes to public, maybe a little bit. The reason I'm telling you this is if the surrogate asks and dig all these things, the time will be wasted. That's the only thing. It's not a blunder or anything, but just ways to say differently so that no questions will come from surrogate other than specific answers. Right, and all the other things. You ask about allergy and medications. I would say you should ask about the insulin dose. I said million insulin, you didn't ask about the dose. In exam, we should ask the dose because in this case, only one medication, so at least two or three will be there. We need to know the dose in milligrams and if insulin units and how often we need to have. Most definitely. And do you realize the point stroke? Any feedback from you? When you said stroke, I said stroke. What do
Yeah,
you?
that was jargon.
Yeah, see, it's not. I wouldn't say it's a complete jargon, but it's a scary one. You can't just like that. Have you had a stroke? Have you had a heart attack? See, he's only 30. That's what we need to be taking care of. Because if you also say him in like a 80, 90 or 70, they might have come to a terms to say like they heard about it. Only 30, you ask about stroke, heart attack and things, they'll be completely panic. Then in that case, you can generalize. If anything like that, you can generalize. But you told, say these things can happen. That's why I'm telling you that's fine. But just avoid all those things. And again, you said numbness or tingling sensation. I said I asked where. So be specific in your question in terms of. And IT. Why did you say that? I said IT, and then immediately you asked how is affecting your life.
I mean, people even at workplace, can affect, like vitiligo can affect you because of the workplace, or because of colleagues can comment, or like that is what I mean.
That's okay, but again, little bit explanation. Because I see when you asked me, is it affecting your life means, I immediately thought my profession. I said
Okay.
IT, then immediately you said, is it affecting your life? So I thought, well, why IT life? Why IT? Being IT is affecting my life. That's my profession. So you could have just a little bit more in terms of okay, being an IT, how is the profession going on? How is your work? And then you can ask, having this patch, do you think it's affecting your job? Generalize. I know that because of the time pressure, you're just telling everything fast, but some little words may confuse people. So a little bit careful. Just rephrase the thing. That's all. And you ask about everything: smoking, alcohol, pale palpitation, system analysis, mood. Again, I said very anxious. And again, when I said very anxious, you didn't say anything like, okay, we'll take care. You said at the end, and only one time you said in terms of, yes, I can see you're really concerned. And then I explained you at the end about the plan. So that's only one time you reassured. Other times you didn't say anything. That's the main thing. And examine investigations, basic, I don't know, we have to explain in terms of when you say investigations, either blood test or any testing the skin. Do you get any scrapings or look for any infection or anything just to rule out things? You can say like that. If you want to generalize, like a blood test and then some general and specific tests related to the skin to see are there anything going on. You can say that. No need to specifically say. And I don't know whether knowingly or unknowingly you said ANA. That's again, it's a completely jargon. People don't know anything about autoimmune ANA. So avoid ANA when we talk to the patients. Examiner is fine. Patients is difficult. And without notice, you said refer to the skin doctor. That's most commonly said mistake, because at the end of the day we think, okay, I'll refer you to the brain doctor or the nerve doctor, and we are the neurology clinic, so we can't do that. We can say, I'll discuss with my seniors and things. It's like a mistake, but people will catch you. And with the examiner, you immediately went into polyglandular syndrome. I would have started with merely vitiligo. I wouldn't have said with the polyglandular at this point of time. And then the next is, your DD is right, post-inflammatory hypopigmentation, you said. And also leprosy, you mentioned. I'm not sure whether you mentioned leprosy when I first asked in the DD. Did you mention? Because that's why I repeatedly ask in terms of, have you mentioned leprosy?
I'm not sure if I mentioned first time, but that was always on my DDs, immediate next DDs for vitiligo.
Yeah, it's in your DD, but I don't think you mentioned. You said polyglandular hypothyroid, adescence, post-inflammation. That's what you said. You didn't say the word leprosy when the examiner asked about the DD. But you mentioned, I'm not sure whether you mentioned, the later time we mentioned, we'll see. But we need to check. When you're not sure, just say, I'm not sure. Don't confidently say, yes, I did, because they note each and everything, and then it will be a problem. And you said I can't see any signs of hypothyroidism or adescence. We need to be careful. It's not signs. You got information. It's a history. You didn't suggest any signs. You have not checked anything because it's a history station. And finally, we did the DD. You said leprosy, post-inflammation, adescence. The commonest Pityriasis Versicolor is a DD. So fungal infection. That's why like a fungal scrap and things needs to be done. So that needs to be told. And hypopituitarism is also an important thing in terms of the DD. But don't get too much. Like 5 DD should be fine. See here, typically it's vitiligo. The next thing is post-inflammatory. Next thing is leprosy, and Pityriasis Versicolor. And then you can add additions. Or if you generalize like albinism, can be a diagnosis as well. And in terms of how do you manage when he's getting married, so again, like a different skin cream, like a camouflage, you can cover it like a, say, it's not ideal. And you said about cosmetics, that's like a makeup thing. You can camouflage and see if it happens in the face, you can cover it. That's the whole anxiety about. At the moment, it's not a big thing because it's in the hand. You have to ask him. But even for the hands, he said it was a big thing. His main worry was how he's going to be in his wedding in 4 weeks if he develops similar thing on his face. Okay,
Okay.
right. That's good. That's good. Overall, it's good. So I don't think people will mark you down for this. But whatever I'm saying is to improve things so that the examiner didn't even think about marking you down. You get the full marks. That's what I'm giving you the feedback, each and everything. Okay. Right, few more thing. I don't know you all in terms of names, but if you are new to this session, we have a free live videos, including this one will be there shortly, in website www.waytopaces.com. And if you want to follow, you can follow us in like Facebook, Twitter, Instagram, anywhere you like. Right, any questions before we?
I was asking, do you think I could have explored more allergies or any previous history of allergies or uh, uh, like atopies or
No,
eczemas
no,
or
no, no, I don't think so. Because it's like a definitely, you asked in terms of itching, redness, or anything. You asked clearly, and you asked has it happened before. So this is not going into allergy. It's only the 5 or 6 differentials, and then you focus on that. I don't think you need to ask about atopia and things here.
oh,
You've done the right thing. So your flow is good, but at the end you're very fast. You're very fast at the end because of
I
the
was
see
trying to
face to face.
systemic,
Sorry.
I was trying to cover the systemic review because I haven't done that. So
I know, but it's a face to face, it's okay. In the video or even without the video, it's very difficult to follow you. It's very fast. So I didn't say
okay.
anything. But see, when we try to be fast, if the surrogate is not happy, they can just pause it and then say, "I don't understand. Tell me from the beginning." So we need to be a little bit careful about our speed, and that comes in practice. I know because when we miss something, we want to do something, and then we're getting it faster. Then you can see if you want to do that. I do that in practice sometimes when there is no time, you've got only 5 minutes to examine or 5 minutes to get history, but you have to warn the patient, warn the surrogate. You can say, so I usually say it's like a rapid fire questions. It will be bit quick. So I've got a list of questions. Can you please answer? And they'll say yes. And then you can say chest pain, palpitation, this, that, headache, skin, everything. You can, but sometimes you get a big clue from system examination. If you didn't get a clue in the main history presenting illness, then the system examination will be the key.
Yeah, I think, sir, Dr. Siraj, if I have missed, I know, I'm not sure. First, he didn't mention any confirmed agenda of the meeting, today's meeting. And second thing, he did not get consent. I'll write down few notes during our chat. I think whether I missed or he missed.
Right. That for that I'm not sure. See, either you can do it or not. When you can say you GP referred and you straight on talked about it, that's okay. Writing notes again. This is not the video, so I don't know whether he took notes or not. If you are taking notes, always you have to mention yes, I'll be writing notes. And the other point about writing notes is it will take extra time. So don't think you just talk here and then go in the exam and write the notes. So if you start writing the notes, I'm not saying writing the notes is a bad idea. It is a very good one, but we need to be timing yourself because at least 1 minute you need to write the notes. So whatever you are doing, you have to do less than a minute. So if you are practicing with writing a notes, practice with your friends as well and then write the notes and see.
Right. Thank you.
Okay. And the key point here is the first 5 minutes before the session, anything. In PACES, except for the examination sessions, all the other important ones, then those 5 minutes, so once you get hypopigmentation or a white patch, the first thing is vitiligo, everyone knows. And then you have to write the DD, and then what I have to ask, what are the tests is there, and you have to make a note and make your mind towards that and just go and do it. Okay, thank you. If there are no questions, I'll stop the last call. Any questions? No? Okay. Right. See you. Bye-bye.